remember the time when the vaccine, COVID-19 vaccine was still to be launched? That was early 2020. No, no, the middle part or the late part of 2020. And there are so many anti-vaxxers all over the world. Facebook, left
Yes.
and right, they campaign not to receive any vaccination for COVID-19 because, for lack of better term, they term it as maging zombie tayo dyan, etc., etc., right? If we follow them as per their understanding of protection for COVID-19, then we might be the whole world, the large population of the whole world might be diminishing even up to now if we did not receive the vaccine.
Good day. Welcome to the Leader's Edge. Today, we have something that a lot of people have been waiting for. And this is our special show for you, dedicated to you, those who are concerned about the current situation about COVID-19 and what's happening. Is it improving or is it worsening? We have somebody who is not a stranger to us. He has been our featured speaker 4 times in the past, and now being a public health advocate since the start of the COVID-19 pandemic in 2020 with all up-to-date, validated, verified information. So this is so timely for all of us. He is a workplace occupational health and wellness guru focusing on prevention and control or holistic wellness. A medical doctor, a nurse, and a medical technologist. Currently an OHS consultant and trainer of various corporations and adjunct faculty on Masters of Occupational Health at UP, Manila. I am not going to make you wait much longer. And here he is, our special expert, dedicated COVID-19 expert. And we have Doctor Renato Noy Josef. Welcome, Doc Noy, to our virtual stage. And of course, Doc Noy is episode 6 of season 11. So, Doc Noy, your stage.
For that kind introduction, good afternoon, my friends, ladies and gentlemen. It's thank you for having me here again in your show, and it's nice to be back again. How are you, Miss Dina?
Right. Doc Noy, first off, ito na. Because while most people, all right, in other words, the impression all over the world is that Filipinos are masunurin because most other countries are not masking anymore, especially America. When I went there, nobody was wearing a mask. That was as recently as August. So here I can see there are many people still wearing a mask, although every now and then I see that they do, but they take it off, and most of the time, especially in the restaurants, wala na. So, my question, Doc Noy, is it true that we are already having a what we call herd immunity?
Herd immunity. That was that term was a long term. Was already, I think, a passe that was announced early on when the COVID started in 2020. I must say that it's more of the population in the Philippines has acquired the natural immunity. Yes, because of the many COVID variants, including the sub variants, it already affected the good ratio of the population, plus the fact that we have a very high vaccination rate. And that's good news for the Philippines. Probably that these are the two main reasons why up to now we are still not having a good number of increase or surges in cases, because in a way we are protected naturally and through the vaccine. That's good news for us, Miss Dina. So herd immunity, I
Yeah.
would believe that even WHO has already modified that term herd immunity. It refers that to the immunity of the population, so to speak. Because I remember 2 years ago, they kind of junked the term because herd immunity connotes many, many factors that contribute to the resistance or the resilience of the population against COVID-19. All right?
All right. All right. So how do we explain the fact that I just saw on TV was the other day that DOH announced that they in their warehouse, in their stock room, they have over 1 million vaccine shots that are not yet, given out. So is it because there's still a lot of holdouts, people who really refuse to be vaccinated?
As I have mentioned earlier in the first item that you raised, Philippines has a pretty high vaccination rate. And of course, the vaccination that came out in the news, probably these are reserved vaccines and are expected to be yet to be given for some people. And at this current time, when the variants and sub-variants are continuously evolving or emerging from in the other countries, I think this is the right time for the government again, DOH, to campaign that people get their vaccination, their vaccines, because the recent data still show that people who get hospitalized with the emergence of the variants are people who have not been vaccinated or have not received their vaccination, especially the booster doses. And
All
plus the
right.
fact that there are a great
Yes.
number of people who belong to the not so young population anymore. So they're vulnerable to have this COVID-19 infection.
All right. Doc Noy, I know somebody here happens to be a friend of mine. She loves to travel. And because she does, is there such a thing as over vaccination? Because she has 2 vaccinations, the original 2 shots, and then she has 4 boosters. Is that not harmful, having too many vaccinations done on you?
That's a great question, Miss Dina. The vaccination doses, just like the COVID vaccination doses, just like any other vaccines, are well studied by scientists so that their dosing intervals are well spaced. The basis of which is the amount or the level of immune response of the body when somebody receives the first dose and subsequently the second dose and the first booster and the second booster. So if a person insists on having to receive more than the required doses, the studies would point out that the immune response for this person would be possibly not adequate. So it's a misnomer. Akala niya he would be or she would be more protected with more vaccine doses. No, it's not. Because doses has to be spaced in the right interval for the immune response to be optimized.
Okay. What do you think of people, Doc Noy? Because I really heard of some, people absolutely refuse to be vaccinated, and then they intentionally get infected by not wearing masks, no social distancing, because they believe that being infected is a better immunity later than actual vaccine. They say, oh, mas natural yung aking immunity because I really got the COVID. So now I'm more immune than the rest of you. What do you think of that?
I thought that's a very smart question, Miss Dina. You know what? I would relate this item in relation to what's happening in China. You know, during the pandemic, from the very start of the pandemic, China implemented a very strict lockdown. Totally no people allowed outside their respective homes. So, in other words, the lockdown was so well implemented that nobody was allowed to get out. Of course, we know China is a communist country, and they have a kind of strong leader. Whatever the leader said or says, people will follow. So what happens now? The past months, they discontinued the strict lockdown that they have. So what happened? When people got out, people got infected now with the new variants of COVID-19 because they do not have the natural immunity that was supposed to be received by the natural infection, by the natural virus, not the vaccine. And this is one of the reasons why China has a large number of cases of this, so many, more than 500 variants, by the way, now in China. So this is a typical example of a lesson well learned. Moving forward, I would see that our virologists, our scientists would be very knowledgeable enough to improve the protective measures of any infectious disease because of this COVID-19 model that's happening all over the world. Very interesting,
So,
right?
right. Yeah. Now, because a lot of people are beginning to feel really sick and tired of this whole thing. So when is there ever foreseeable future without the pandemic, or do we just need to just accept it that it's there? We just have to live with it.
You know why? It's inclined.
So
You mentioned who would ever see this end. The answer is that simply OD. Only God foresees the end of COVID-19. What happens is, from the very start again, 6 months when the pandemic started in 2020, the scientists already predicted that there would be mutation that will be happening. Variants after variants after variants after subvariants will be reproduced, will emerge. And that exactly is the natural course of any infectious agent. Meaning, this is the way how infectious agents transform themselves in order to survive. You see? You see the evil aspect of any infectious agent to affect many peoples of the world. So, good enough that we have scientists who are smart enough to counter what the mutation results are. That's why, getting back to the point, and I would advance this discussion item, the measure now of WHO, and of course headed by the United States and other big countries, is the administration of what we call the COVID bivalent vaccine. This is not the traditional or conservative vaccine of COVID-19 that we receive. All right, Department of Health is ready to have it implemented Q1 of 2023, I mean, Q1 of 2023, the bivalent vaccine. This is not the vaccines that we received, rather, it has already the mixture of a COVID-19 variants, which later on, they will officially announce it when the vaccines arrive and ready to be implemented by Q1 2023. That means that we have to receive this kind of booster, right? Now, the Centers for Disease Control and Prevention in the United States recommends that the bivalent vaccine must be received 2 months after the previous dose of the first booster, all right? Or after the completion of the 2 primary doses. So that's the preliminary recommendation of the CDC. And of course, for those who have comorbidities, it would be a different picture of the dosing interval. Okay, we will watch this out from the announcement of the Department of Health, which is, I think, it would be forthcoming.
all right. Doc Noy, because I know you are always updated and you keep on doing research on this. There have been several cases in America where they gave vaccinations to young children, and some of them develop what we call heart abnormalities, and it was found out that it was because of the vaccinations. So what do you think of that? So does that mean we should not include children in the vaccination shots?
No. What you're referring to is, I would think that you're referring to myocarditis,
Yes, yes,
inflammation of
yes,
the cardiac muscle or the heart muscle.
indeed, yes,
This,
yes.
which has been long proven to be a known side effect of vaccine. From the very start, the vaccine was started in 2020 of December in the US. It was already projected to have this myocarditis. Now, myocarditis, yes, it is more common among the age group that you mentioned, but also it also occurs in other age groups. Myocarditis, as per the study of the scientists, still, though it happens, is very rare compared with the complications that COVID-19 could result into. So what the good news is, of course, pharmaceutical companies, especially those specializing in medicines for heart diseases, would come out with a specific treatment approach for that specific myocarditis. It's something that myocarditis actually is not that life-threatening for most cases, right? So what I'm saying is, when we compare the side effect of the vaccine, which is myocarditis, versus the complications brought about by COVID-19, it's still very, very far from each other. So it's better that we get to have the COVID-19 vaccination.
I see, I see. All right. So there are cases, huh, Doc Noy? I'm telling you, and one of them happens to be a good friend of mine. No, he got before the vaccines were out, he already got infected with COVID. So when the vaccines came out, he had himself vaccinated twice and then 2 boosters. Lo and behold, he still got infected again. What do you think of people like that? Does it mean he really has a very low immune system? What does that mean?
There could be possibly a number. There could be a number of factors that could possibly be the cause of that incident or phenomenon. One is probably the immune response of your friend was not responsive despite the vaccine that he or she received. So that's one. Number two is, it could be also probable that at that early stage, but that was early on, right? There were no variants, so to speak, as of yet. Though the number one reason could be most likely because of the inadequate immune response of the person to the vaccine that was injected to him or her.
So I'm coming back to the next concern that I have, no? So because obviously some people have higher immune system than others. So what is your recommendation for people to have higher immune system?
We have just to take it that way. I would cite myself as an example, Miss Dina. I think I was not able to share this with you or with our group. I had been practicing healthy lifestyle from the very start, like for 20 years already, with regular exercise, healthy food, etc., etc. Yet I was inflicted with COVID-19, right? Because the theory stated that during that time I was at a very high health level. There is what we call inside our body cytokine, which is a part of the immune response also for healthy individuals. The immune response that I had overreacted to the virus that got into my system. So it's an overreaction or overresponse of what I had, giving me the actual COVID-19 disease. And it was terrible. The theory pointed out that if you're healthy and your immune response overreacted, then you will have a very full-blown and critical COVID, what exactly happened to me when I got hit with COVID, right? So it's an extreme of cases, low immune response versus the overreactive immune response.
Okay. And probably, Dr. Noy, I have a feeling, or I am suspecting that a lot of people are using it as an excuse not to really get vaccinated at all. They refuse. I I happen to know some people that when in their area, in their community, they heard that people from DOH going around giving vaccinations because many of them did not go and have their vaccinations done. So they even have spies to watch out. And then when the people will go there, the health workers will go there to give them injections, they disappeared. They got out of their homes. They ran away. So because they really believe it's bad for them. Because honestly, there are, until now, there are still people like that.
Remember the time when the vaccine, COVID-19 vaccine, was still to be launched? That was early 2020. No, the middle part or the late part of 2020. And there are so many anti-vaxxers all over the world. Facebook, left
Yes.
and right, they campaign not to receive any vaccination for COVID-19 because, for lack of better term, they term it as maging zombie tayo dyan, etc., right? If we follow them as per their understanding of protection for COVID-19, then we might be the whole world, a large population of the whole world might be diminishing even up to now if we did not receive the vaccine. You see, the time when these anti-vaxxers came out on Facebook or over other social media left and right, all I had to do was just, of course, to go campaign against what they're saying also, because they did not have any basis. How I wish I could turn them back and review their video on their anti-vax campaign, and they were totally baseless. At the time, I was in communication already with the experts here in the Philippines. I was in Saudi Arabia then, and I got hold of my, professors at UP Manila, and in fact, the former dean was the head of the panel vaccine of COVID-19, and I got regularly in touch with her, asking the updates of the COVID-19 and the vaccination implementation left and right. And we were one in saying that vaccination is the way to go. And we are now experiencing the benefits of having the vaccination campaign against COVID-19.
All right. So other than that, of course, Doc Noy, more and more organizations, corporations are now realizing that they really need to be concerned about the health of their people. And that's why wellness is number one topic. And of course, there are other things to consider. The psychosocial, because people have been locked down well for a long time. And thankfully now we can just observe proper distancing and then sanitation and of course the masking, etc. But really, a lot of people are still not feeling what we call comfortable going out and then mixing or meeting up with other people. So there's still that doubt that is it really safe to go out? So what do you think?
All right. Let me discuss to you the solutions in the order of the routine public health measures, right? At the current time, it is still strongly encouraged, of course, to wear masks. And by the way, the mask that we should be wearing should be double mask, not just the ordinary mask. It should be a sealed mask in our face for the virus to be prevented when somebody gets to have colds or get on coughing in the public places. That's number one. Number two, maintain safe distance. For me, what I do with myself is I don't stay more than 10 minutes talking to a person on a range. And when I talk to a person, it should be at least 2 meters away. Right? So that's one. And that's number two. Number three would be it's important that we also observe proper ventilation, especially when we are in public places. Right? Especially in the malls, for example, or supermarkets or closed supermarkets, I mean. So there should be ventilation requirements for any building or when we go training or meetings or do office works. Right? And number four, and all the rest to support the primary approaches on public health is, of course, build up the resistance, physical fitness, right? The right nutrition and diet, and manage the stress. Now, dovetailing on the last item on the stress management, what I really strongly recommend to be implemented moving forward is the mental health in the workplace program. People are getting out of their minds because of so many problems, not only COVID-19, but of course it has something to do with COVID-19, such as economic situation, all right? Their finances, right? Their inability to apply for a job because of absence of available opportunities, because of closed factories, etc., etc. So mental health in the workplace program is one, and of course, mental health in the community should also be implemented. I have started it, so to speak, in the company where I'm currently in, to start, making use or the resources of the Department of Health. For example, the National Center for Mental Health, previously called Mental Hospital, has a app, all right, an app which gives or provides consultations for any psychological deficiency that the person might have suffered from. All right, and then from there, screening, and when there is a need to refer the patient to a psychiatrist, then the person in charge of having that counseling and consultation would refer that patient to a more expert opinion. Okay, so making use of the workplace is very, very valuable for the workers to be productive in their work. Okay? It's not a hard program. It's easy to be done, provided the leadership or the management team should be very attuned to what's happening. Okay.
Indeed. So, Dr. Noy, because it's number one now in people's minds around the world, it's the surge of the pandemic in China. You know, it's like a rebound thing or something. Have you heard of this white lung variant in China that they found out?
The white lung, Miss Dina, is nothing but a chest X-ray finding of the lungs when the lungs is infected. So it's a non-specific findings in the lungs, right? I listened carefully to that news item about the white lung in China, and mind you, it will naturally die off. It's natural death because it doesn't hold water in terms of this uniqueness of the so-called white lung. Again, white lung is a manifestation, is a radiographic finding in any kind of infection, not only COVID-19, right? Specifically, the white lung could point to a pneumonic process inside the human lungs. It's not only about COVID. All other infection could produce pneumonia in the lungs. Okay?
Would you happen to have the statistics, Doc Noy, of the total number of people in the Philippines that have been vaccinated, boosted, etc.? I mean, you know, that they are relatively safe or they are safer than those who have not had vaccines. So what is the statistics about that?
What I learned from the Department of Health as of the moment is we have hit the more than 80% mark of the completion of the vaccination. All right? So that it is well accepted that our immune system, in terms of the infectiousness of the COVID-19 in the population in the Philippines, is okay. All right? Now, let me introduce to you two terms which are related to the prevention of COVID-19. When a person completes the first two doses, like the first dose, the second dose, which are called primary doses, these are labeled as by CDC as complete dose, meaning it has already affording the individual a good chance of protection, a good level of protection. The number two term is updated. Updated is the person has, on top of the primary doses, has already received the booster doses. Okay? And CDC points it to the completion of the first dose and the second dose for high-risk individuals. Okay? So everyone in the audience could think about it. Are you a complete dosed vaccinee or a updated vaccinee? Of course, the second one would be more preferable than the first one.
And of course, Doc Noy, the thing that it's a reality now. There's what we call the travel revenge. A lot of people now can hardly wait to go out and travel. And the requirements vary from government to government, country to country, but indeed they are asking for vaccination or RT-PCR test before they can come into the country. So would that be enough to prevent possible surges again because of people coming from, let us say, maybe they're not coming from China, but they already met some people from China who traveled to, and then they got infected. So there's always the probability of them bringing it here as well.
The decision of the leaders of the different countries of the world to permit travel despite the emergence of variants and subvariants is because of the high vaccination rate globally, so to speak. And number two, because as of now, despite the emergence of the new variants, even in November 2022, it's most likely that these variants and subvariants, although they are highly transmissible, they do not cause that high level of deaths, or we call mortality. So it's just like when the time comes, it might become like a simple colds, where in fact, many people or a number of people also die because of just a respiratory tract infection. That is what I'm seeing when the time comes. COVID-19 will become as such. It's just like an ordinary flu, not lucky enough for some people, for few people who would be losing their life because of this flu or COVID-19 in the future. Okay, so that is the reason why. And the other reason is, as of now, WHO and other global health agencies are in the process of studying whether the kit that we are using could also detect the variants and subvariants. Because it doesn't make sense if we continue to have this tested, these new variants and subvariants tested, where in fact the kit is not sensitive anymore. So it will not meet the objectives of having the travelers tested. So these are considerations. And of course, not to mention, and leaders would make it as a top priority because of economy. The world cannot survive anymore with the absence of people traveling to and fro from their respective countries.
Indeed. So I'm glad about your earlier when you mentioned about the mental wellness, that more and more corporations are becoming aware that there's really a need for corporations to provide such kind of facility or resources to their people, because you never know. You never know it. what will happen next? What are the next recurrences or any other what we call variant that will come in from whatever country, wherever. So there is that what we call crying need for people to be reassured. So this would form part of the mental wellness program that you are well aware of and that you do provide to some corporations, right, Doc Noy?
Yeah, yeah. Can I say something to that before we go to the
Yeah,
Q&A portion? Miss
yeah, please,
Dina,
please.
in the most recently concluded forum that I had with UP Manila, I got the
Uh-uh.
permission of the company that I'm serving, one of the companies I'm serving now, to present their health promotion program. And I included is a component of the mental health program, the spirituality program. Miss
Oh,
Dina, come
okay.
to think about it. As I have mentioned earlier, we, even who the leaders are, how great they are as leaders, do not have the control when this pandemic will end. It's
Mm-mm.
only God and God alone could have it. So unless we
Yeah.
resort to a good workplace, in other countries they already started that workplace spirituality program. I am afraid we could never have a good level of sanity and among the
Yes.
workforce. Yes.
Right, right. So, wow. That is such great news, Doc Noy, that you are there and you're very much involved, and that corporations can actually avail of your service. Now, there are a lot of people here with us in the room, so it is time for them to ask what are these nagging questions or concerns that they have, because I know it's there. It's there. So please go ahead and start asking your questions now. You can just put it in the chat, right? You can write it down in the chat, and we will really be delighted to ask. And I'm sure Doc Noy will. Oh, all right. So I guess this here is somebody. All right. So Zaida, but I know you explained this already, Doc Noy, no? What so-called completed and updated. So parang siguro they need some kind of additional in information about what is the completed versus the updated, etc. And what's the difference? Yeah.
It's good to re-emphasize that because when the Q1 opens for the bivalent vaccine, people would be
Uh-huh.
ready and on their level of understanding. When we say completed dose, the person is already afforded a good level of protection, which refers to the completion of the first dose and the second dose, which both of them fall under primary doses, right?
Mhm.
So depends on the vaccine. It has an interval of 30 days or some 45 days, etc., etc. Or the one vaccine has only a single dose, which already is considered as a primary dose. So that is a completed dose. Meaning, if you already only receive one dose, that is not a complete dose, of course. You have to complete the dosing recommended dose of the pharmaceutical company. Whereas the updated dose is when the person receives the booster dose on top of the primary dose. The health agencies worldwide have studied that the level of protection is far greater than receiving all the primary doses alone. So when the time comes, when this bivalent vaccine comes in Q1 2023, I would strongly encourage that each one of us who have completed the primary dose or completed the first booster dose to go the bivalent dose 2 months after. 2 months after. This is a CDC guideline. But what I've heard from our local Food and Drug Administration, there is a good chance that they will also follow the recommendation, which is 2 months from the previous dose that one receives. Okay, so I guess that would be clear enough.
Yes, yes, I believe Yes, that is clear. Now there is another. Okay, we have a guest here, Alvin. All right. His concern is, why is it that there are now 20 million doses? DOH has 20 million doses of the vaccines that have expired. What happened, and why was it left there?
Mhm.
To expire.
Um, you know, in as much as the Department of Health, in cooperation with also the other private agencies campaigning for the vaccination, we cannot really help, but there is a certain group of the population that is really hesitant or reluctant or totally would not receive the vaccine. And we know for a fact that Philippines, being a democratic country, and in other countries as well, all over the world, we could not hold an individual and force that individual to be vaccinated. All right. Have the freedom to choose whether or not to receive the vaccine.
Mm.
What we just lack in our part as public health professionals is probably we still lack the rah-rah-rah campaign of the benefits of the vaccination. Okay, so I was seeing in the chat box with the question of Alvin J. Unfortunately,
Oh,
20 doses expired. The good news here is the WHO and the suppliers have a certain agreement that the expired vaccines returned, could be returned. I've read such an article that they
mm,
are acceptable to be returned and they are accepted as as irremediable. I mean, with nothing we can do, as I have mentioned earlier in my discussion. And that is a loss,
oh,
of course. That's a loss.
right, right. So for those, okay, whether you are vaccinated or unvaccinated, and hopefully, honestly, I was overjoyed to hear from you, Doc Noy, that there's already 80+% of the population that who are already vaccinated. And that's probably the reason why we don't have so many reported deaths anymore. Practically, it plateaued. There's no more alarming rate of deaths like in the past. So, well, would that be correct? That's the reason, because of the high percentage of vaccinations.
You know, what had happened in the past 2 years is a product of a set of factors contributing to the decreased mortality. If we get back to the Spanish flu back in the early 1900s, it had killed more or less 50 million people.
Mm-mm.
Imagine at the time, population of the world was not that huge yet compared to what we have now. Now, as of time, we only have more or less 6 million deaths all over the world. And what I'm saying here, it's a contribution of public health campaign, the vaccination effectiveness, the campaign for ventilation, the increasing the resistance against diseases, etc., etc. So for me, I thought we're doing a great job in as far as this
So,
pandemic is concerned.
yes, yes. Going back to history, Doc Noy, because this is not the first pandemic of its kind. There were many, many other, in the past, that where the whole world was involved. And of course, then at that time, they had like several million, hundreds of millions of people who died, right? So now this is what we would call, for you, having 6 million deaths total. Would you call that not some kind of, it's more or less, it's minimal as far as the total world population is concerned? Would that be the right term?
Yeah, it's a right statement. We are better off compared with the previous pandemic that happened in the whole world.
That
And
happened
in
before,
fairness,
yes.
science now is so advanced in terms of its research capabilities. We
Mm.
have so great minds all over the world. Researches, even up to now, are ongoing. WHO is accepting so many researches on COVID-19 up to now. And not to mention, of course, the pharmaceutical companies who are having their own research and development, all right, with of course the agenda of selling their vaccines.
Yes, yes, of course. Okay, so what for you? Okay, Doc Noy, no, you've been through a lot through actual experience and studies and research. What for you really would be the best prevention that people can have at this time?
It's simple response to that, Miss Dina. The most effective is spirituality. We should believe that God is in full control of everything. Period. If you ask me the second one would be vaccines. Okay? And the third one would be a mixture or combination of the many factors like ventilation, the wearing of masks, etc., etc. But that's just focus on the first two. God, number one.
What can you say about people who might be atheists, or maybe they're not really practicing Christians? They say they are, but they're not really practicing their faith. So, in what ways can they become more spiritual?
All right.
Doable ways.
Obviously, with bias, I would campaign for Christianity because I would assume that all of us here in the audience are Christians or Christian Catholics, right? When I say Christians, I refer not only to the recovery from COVID-19, but how that individual will journey himself or herself towards or against the challenges. All right. Now, some people, non-Christians, would believe otherwise. It's all about the other religion would more or less be on mind over body. Before I became a Christian, I was a full-fledged scientist that whatever the mind thinks, the body follows. Now it's different. God is in control of everything. So would it be more effective? God over our mind and our body compared with the other religious sects?
In other words, faith, having faith and putting your hands, or putting God in the center of your life and offering your life to the Lord and living your life, not only for yourself, but for others. As I might say, I might add, Doc Noy, I might very well give you that description as well because of your, I would say it's not an ordinary concern that you have. You really have devoted, you are continuing to devote a huge part of your life, your time, your effort in continuing research, and meaning you are not stopping here. You continue to find ways and means to impart, share all of this knowledge to others. So that's all part of your faith. That's how you offer all this to the Lord, right? Am I correct, Doctor? It's all part of your what we call giving. Yeah.
What you've mentioned is God's design for me. I firmly believe in that. The fact that He gave me second life is giving me the opportunity to provide people of the knowledge that I had. You know, being a nurse, a medic, a doctor, and a teacher all at the same time is not an easy job to do. Yet, He gave me opportunity to serve properly, in proper perspective, all the knowledge that I have. And this time, I'm very grateful because on top of the knowledge, there is what we call the wisdom that I'm imparting to all my clients, participants, and community people. Praise the Lord.
So
I think there is one question, Miss Dina. There's one question there.
Can you read it for me, Doc Noy?
Yeah. The question from Miss Saida, what are bivalent COVID-19 vaccines? And do we really need to receive this kind of vaccine? All right. Let me explain. Bivalent, it is called bi because the COVID-19 vaccine that is to be implemented
Oo.
is consisting of the conventional COVID-19 and the variants of COVID-19. So it's called bivalent, right? Bivalent, they came out with this bivalent vaccine to protect the people from these new variants and sub-variants, okay? Which the ordinary vaccine in the past may not afford the protection. So the second question, do we really need to receive this vaccine? Of course, we have to. We have to. And I just pray and hope that our government has still the budget for that for us.
All right. Doc Noy, there's another question here saying, do we really need to? Because honestly, me too, I'm asking that question for me because I do reserve time for brisk walk. Like I allot myself an hour for that every other day. And I find it difficult to do that in the open air and at the same time wear a mask. Should I really still wear a mask? I'm out there, ventilation, open air, and I'm doing brisk walk. Do I really still need to wear a mask?
All right. Good question again. I have to confess something. Miss Dina, you go where I'm going, you visit the bank where I go, you go to malls where I go. If there's one person who's not wearing the mask, it is myself. I
Okay,
do not
okay,
wear mask in public places. Basically
okay,
because I have completed, I am updated on the vaccine. That's one. Number
okay.
two, I observe proper distancing. Number three, I go for well-ventilated places. And number four, which is the best part of it, I believe and I put my 100% trust on the Lord.
All right. Yes, I mean, yeah, I feel relieved to hear that from you because sometimes when we're doing brisk walk and doing other exercises and it's out there, outdoors, and at the same time you wear a mask, sometimes I find it hard to breathe because of
Yes,
the
yes, yes.
mask, because I'm exerting effort. So I'm so glad to hear that if I'm outdoors doing exercise, I it does not mean it's bad if I do not wear a mask. And so thank you for that, Doc Noy.
Let me add this before we end probably the 45-minute talk, 45-minute session. On top of that, in top of the four things, I ensure that I live healthy lifestyle. All right. I do not eat anything more than vegetables and fish and just an adequate amount of rice. I manage my stress, all full smiles wherever I go, enjoy life, as I have mentioned, because God is with me, and that settles the issue. You can
Yeah.
you can go out without your mask.
Yes. Thank you. I'm telling you, I'm sure I'm not the only one. Doc Noy, I'm sure I'm not the only one who's feeling a great sigh of relief. Oh, thank God. you know, because I just feel many times that it's not necessary anymore. But then I see other people still wearing them. So I that's why I began to wonder. so,
Mhm. Okay.
but coming from you, I tell you, I take it I take it very seriously. It comes from you. So thank you for that. And I just want to, advise everybody. This is great, and you can always get in touch with Doc Noy. So hopefully, Doc Noy, we will put out your information if you don't mind, or through our company. And I want to thank you so much for devoting a huge part of your life, your time, your energy to this, the number one concern as far as health is, right now, all of us are concerned. And I just want to advise everybody that coming up next will be for Episode 7 and season 11 will be Boogie Boy Dawn on thriving in a digital economy. So watch out for that. And thank you again, Doc Noy. And again, because of course, learning is a never ending journey with limitless vistas. And good day, everybody. And as Doc Noy said, remember a big part of prevention is having faith with all our heart and spirit, having faith in the Lord and observing all the protocols, that Doc Noy mentioned. So good day, everybody. And thank you again, Doc Noy. Blessings, blessings, and thank you. Thank you.